But we are not on the same level here.
Because I don't get sick.
Yeah. Part 2. Let me know when you're here. We had an internet failure and we are back talking about Hashimoto's, thyroiditis, and what it is, some of the facts we need to know about it, and how it's treated and what the condition is. So, Hashimoto's thyroiditis was a disease that was first described, and the different conditions that symptoms that led to the diagnosis was first described in 1912 by a Japanese surgeon, Hashimoto. So Hashimoto's thyroiditis is named after that surgeon that initially described the disease back in 1912. And since then, there's been loads of research around the hypothyroidism that is Hashimoto's, and there has been some new research into ways to assist in clinical symptoms through a gluten-free diet. So first up, I'm just going to walk you through what Hashimoto's is. Now, for everyone who doesn't know, and this was me today, Hashimoto's is a autoimmune disease involving the thyroid gland that's part of your throat, and you'll feel these glands. They can be around here, and now the thyroid gland is responsible for producing two hormones, the T4 and the T3 hormone. And these two hormones are responsible for the M's in our body. So metabolism, mentism, I think I'm gonna say that right, like mental kind of capacities and movement. So if you think that if you have a gland in your body that is responsible for movement, metabolism, and some mental states, that if you have a dysfunctioning gland there, then the knock-on effect of that dysfunctioning gland means that you'll have issues with metabolism, issues with movement, and issues with mental conditions. So now how does the thyroid become dysfunctioning? There are several ways, several reported causes of dysfunctioning thyroid, and the thyroid condition that causes Hashimoto's is hypothyroidism. So, which means that the thyroid is not functioning, and it can be atrophy, so it can be dead tissue, and a lot of the times it develops into a goiter, where the fibrous tissue within the thyroid has kind of become really stringy and fibrous and no longer functioning the way that it's supposed to make these T4 and T3, make this T4 hormone, which then breaks down into T3. So several things can be the root cause of this. Some medications can cause thyroid dysfunction. Lithium is one of them. Other medications to do with treating hyperthyroidism, so when someone's thyroid is over-functioning, that medication can actually cause the under-functioning thyroid condition. Then there is cancers, tumours, growths, things like that around the throat, which can also cause the thyroid to dysfunction. But there's a whole bunch of genetic risk factors as well. So I'm going to step through some of them. Okay, also, sorry, there is a lack of iodine in your diet used to be the #1 cause for Hashimoto's and the underactive thyroid. And so you'll know that there is foods have now been fortified with iodine to address that health issue. And a lot of table salt is fortified with iodine, and some other common foods as well. So a lack of iodine, it has been linked to the underactive thyroid in the past. There's genetic conditions associated as a risk factor, including Down syndrome, Turner syndrome, and also the gene HLA-DR3, which is linked to people who have Hashimoto's, and also Graves' disease. which is the hyperthyroidism, which is the overactive thyroid. So the medications to treat that actually can cause hypothyroidism and Hashimoto's. Stress is the number 2 factor that contributes to thyroid conditions in Hashimoto's. Having a family history, which is linked back to those genetic conditions. And really interestingly, I had no idea about this one, is gender. Being female puts you at a 7 times higher risk. So for the number of Hashimoto's cases, it's 7 to 1, so female to male. And with the hormone-related endocrine system, I don't know the underlying cause of that, but it's linked to hormone endocrine system. So females are more at risk, and as we age, we become more and more risk at developing Hashimoto's and underactive thyroid. Now, okay, so we'll do that. So what happens is the hypothalamus in our brain makes a TRH hormone, which goes into our pituitary gland, which releases TSH hormone, which then acts on our thyroid to make the T4 and T3. Now, when you have like a dysfunctioning endocrine system that way, either overactive or underactive is when you have the issues making the T4 and T3. So to treat Hashimoto's from a medical point of view, you can get endogenous or synthetic T4, and you take that. It's called a lot of Hashimoto's patients are on this. It's called levothyroxine, and it's actually the T4, and the thing is like 60 to 70% bioavailability of this hormone, and it actually breaks down into T3 as well, so that can go on and function with the movement, the metabolism, and the mental condition to improve mental function. Now, why do we have the autoimmune side of things related to Hashimoto's? Is because the thyroid is actually often being atrophied, so attacked and killed off by our body's own immune system, and that's because people who have Hashimoto's have defective T cell suppressors. They have cell-mediated destruction of the thyroid follicles, so that's that goitery kind of enlargement. Then they have B cell mediated production of antibodies against the thyroglobulin, thyroid peroxidase, and the TSH receptor. So to be diagnosed with Hashimoto's, you have to have high levels of the TSH, which is the hormone that's produced by the pituitary gland, and you have to have very low levels of the T4 produced by the thyroid, and you need to have antibodies against the thyroglobulin and the thyroid peroxidase. So they're all the different signs and symptoms, ways to diagnose, but other signs and symptoms of Hashimoto's besides those diagnostic tests are hair loss, coarse hair and dry skin, and preorbital puffiness, so quite puffy, weight gain, intolerance to the cold and hypothermia, history of muscle cramps, you have a lower heart rate, and delayed tendon relaxation, so you might have quite stiffness in your hands and extremities. Also constipation because you have the slowing down of your gastrointestinal system. You have menstrual problems and abnormalities because of the slowing down of metabolisms and movements in the body. Also, you can have fatigue and high levels of depression in patients who have been diagnosed with Hashimoto's. Now, I'm just going to check my notes again, see if I didn't miss anything. So please feel free to write some questions I can get to in a moment. So the TSH, the hormone that's produced by the pituitary gland, there's a link in there about ineffective or modified TSH production of that particular hormone when you have blood loss during childbirth as well, so that can be a trigger for Hashimoto's. So it's estimated that up to 10% of the population has this condition, and that our chances of developing this condition increase with age, and especially if you're female. Okay. Cool. Now, to get to the gluten-free research around reducing the clinical symptoms of Hashimoto's, I'm going to actually read some of a paper for you. But before I do that, I'll have a look at any questions here. And thanks for rejoining on this second attempt. You might, if anyone's just joining for the first time, you'll have missed that I was actually I'm isolating at the moment because I had a COVID test because I have a sore throat. Okay, so Nat says, my understanding is that it is the balance between iodine and selenium rather than lack of iodine per se. Well, the iodine balance is very, very important for the thyroid function. So too much iodine actually causes hyperthyroidism, and too little causes hypo. So it's a very fine balance, and you don't want to have too high or too low iodine levels. So it's a balance there to ensure proper thyroid function. But if you have other primary indicators, issues with TSH production in the brain and other hormone functions that are required upstream, then the balance of the iodine is not necessarily going to be the defining factor. But this is for Hashimoto's. So it could be different in other thyroid conditions, and there are many. This is just one of. Okay, next question. I take L-troxin. It does the same as levothyroxine, but it doesn't need to be kept refrigerated. Oh, that's so it's more stable, that means. Okay, you explained it better than any doctor has ever to me. Oh, well, that's good. I hope it's been useful. Okay, so gluten-free, and why is there so much information about gluten-free diet and trying to understand. Some people are saying that gluten causes Hashimoto's, and that is not true. What the gluten-free movement around Hashimoto's is to do with is to alleviate the clinical symptoms. So this is to alleviate antibody production, alleviate some of the inflammation. It's not necessarily the silver bullet that's going to cure a Hashimoto's condition, because Hashimoto's is an autoimmune disease. Once started, these things need to be controlled, and they can't be necessarily undone. Okay, so I'm going to read to you just a small chunk, so please bear with me. Okay, it is the effect of a gluten-free diet on thyroid autoimmunity in drug-naive women with Hashimoto's thyroiditis, a pilot study. So this study was conducted on a group of women who had been clinically diagnosed with Hashimoto's, and they are not taking medications, okay? So they're just using the gluten-free diet to manage their symptoms, okay? Okay, so as background, autoimmune thyroid disease is often accompanied by celiac disease. The objective of this study is to investigate whether a gluten-free diet affects thyroid autoimmunity, hypothalamic pituitary thyroid axis activity, and thyroid function tests in women with Hashimoto's thyroiditis, and incidentally found positive anti-tissue transglutamase antibodies. Okay, so the women in this study have the antibodies that are the underlying definer for Hashimoto's. Okay, so it's not just any thyroid condition; it's the chronic thyroiditis. Okay, so this study included 34 women with autoimmune thyroiditis, divided into two groups. The patients belonging to group 1, we'll call them group A. There were 16 of them. They complied with the gluten-free diet for 6 months, while the remaining patients in group B, there was 18, they remained in the study without any dietary treatment. Now, serum titers of thyroid peroxidase and thyroglobulin antibodies, as well as serum levels of troponin and free thyroid hormones and vitamin D were measured at the beginning of the study and then again 6 months later. So what this means is that they took a blood sample from group A and group B, and they looked at the different levels of the thyroid related hormones. So the one that's produced in the hypothalamus, the anterior pituitary gland, and the thyroid, so the T4s and the T3s. And they also looked at vitamin D levels, because by association, they'll go up and down depending on how much of those thyroid hormones are around. So by taking those samples in the beginning of the study, they have a baseline for these groups and they create an average for each of the group. Then they can look at the impacts of a gluten-free diet on all those different markers for the Hashimoto's. Okay. Based on tryptophan and free thyroid hormone levels, Jostel's, okay, so there's a whole bunch of other tests that they define their markers within these tests, so I won't go into that. Okay, now results. All patients completed the study protocol. Okay, in group B, so this was the group that had the gluten, that didn't do gluten-free. So in group B, the serum thyrotropin and free thyroid hormone levels, vitamin D, as well as the calculated indices remained at similar levels. So everyone in this group of untreatedness, their levels remained the same. So they didn't see a spike or a drop in their baseline of their thyroid or Hashimoto detectors. The gluten-free diet reduced thyroid antibody titers, as well as slightly increased their hydroxyvitamin D levels by this blah blah index. Okay, in group A, the impact of the antibodies and the antibody titers correlated with the changes of this blah blah index, whereas the impact of the blah 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 changes in vitamin D levels, blah blah blah. So quite complicated stuff going on in there. But in conclusion, the results obtained suggested that the gluten-free diet may bring clinical benefits to women with autoimmune thyroid disease. So by reducing by seeing a reduction in the autoantibodies to the different parts of the thyroid dysfunction in Hashimoto's, they were able to say that a gluten-free diet was the cause of that. Now, why a gluten-free diet? We won't go into that in this episode because we've already been almost 25 minutes, but in some people don't respond well to gluten because it's very inflammatory. And over the years, with the pressures on the farming industries, wheat and other gluten-containing foods that we have in our diet is very different to how we evolved side by side. And gluten is almost toxic to some people. That's probably an episode all in itself. But by reducing the overall inflammation in people with Hashimoto's through providing the gluten-free environment, then they were able to see differences in the clinical symptoms based on the antibody titers. Antibody titer just means level. Okay, so I'll see if there's any questions. I got my blood tests today. I've had Hashimoto's for 12 years and my TSH was very low, but T's in good range. Yes, so there is primary indicators and then there's secondary indicators. Depending on which part of your endocrine system is dysfunctioning, you can have high levels of the TSRs, TSHs, but low levels or normal levels of your T4s, T3s. It's different for everyone, and you'll need to see, like a specialist will need to be able to interpret your particular blood results for that. Claire says, I took my son to see a hematologist who had a special interest in autoimmune, and she said from her research, anyone who had celiac gene shouldn't be eating gluten as it increases your risk of other autoimmune diseases 14 to 30 times. Yes. And now, are we talking about the back to my the gene responsible in Hashimoto's is HLA-DR3. So I think you're talking about that one. Okay. My antibodies have been dropping since going gluten, dairy, sugar, and soy free. Oh, that's awesome, Faye. Danica says, so if anyone didn't catch it, and I don't know if I repeated it in this second part, but this is a special edition for Danica on Hashimoto's and gluten free. And Danica helps me out with the Fardyfax Instagram legend. Thank you very much. When I went so Danica says, when I went gluten free, I dropped 24 kilos. My pain levels dropped, my brain fog lifted, and my levels are almost in the normal range. My sleep patterns changed. I couldn't believe the change. Yeah, so Danica, you must be, a particular responder to the gluten-free environment that your body was craving, and having lifted of the brain fog. Well, we know that there is psychiatric links into one of the clinical symptoms of signs and symptoms of Hashimoto's is fatigue and depression. So because those T4 and T3 hormones are acting on parts of your mental capacity, so that makes sense. Okay, super helpful, Claire. Super helpful, Claire. Oh, Claire, I'm in back in Regal. Just FYI. Super helpful, Sarah. I haven't heard that connection before. I've just started looking into alternative treatments for my Hashimoto's. I went gluten-free, dairy-free when breastfeeding Isla, as she has food allergies, and I felt a lot better. Have introduced it all back in now, and I might trial taking it out again. Yeah, and the studies look promising. I mean, this is a small cohort study, which was simple for me to be able to relate to you guys in this small study, but there's loads of studies on PubMed, which is one of the main sources to find scientific research papers. They don't normally come up when you Google, because these people aren't worried about Google SEO. They're not websites. It's like an online library. So yeah, you can look up loads of stuff there. It can be quite complicated, so I'm more than happy to get the facts out of the full-on papers there for you. Okay, well, thank you for joining me, and thanks for being part of part 2. I hope that you learned something, and yeah, let me know if you have any more questions on the thread of this live feed, and I will let you all know when I can come out of my quarantine, because I now have to stay home for 3 to 5 days until I get my test results for coronavirus. But I've got plenty of medicine. I've got some antioxidant, and I have some anti-inflammatory drops. Now, this one here you can just buy over the counter. This one here is Schedule 4, so we'll probably do another episode on this Schedule 4 anti-inflammatory CBD drops soon. So thanks for joining me, and I'll see you soon.